Hello, and welcome to each and every one of you to this virtual event focusing on COVID-19. 1 year later, what's working for women and girls in response and recovery. I'm Melanne Verveer, the director of the Georgetown Institute for Women, Peace, and Security. A year ago, we came together at the outbreak of the pandemic. Already there were signs about potential severe impacts for women and girls. Women on the front lines, the great majority of healthcare workers, impending economic dislocation with great severity, the growing family care burdens with children out of school, upticks already being seen in domestic violence, and so much more. In conflict-affected states, the consequences were already dire. And today, we know so much more, thanks to research that we and so many others have contributed to. We know that COVID has disproportionately impacted women and girls and exposed deep inequalities that must be addressed if we are to build back better. I am thrilled to have with us today an expert group of women, 3 of whom joined us on the original panel a year ago, but all of whom have been at the forefront in the battle against COVID. We are looking forward to hearing their appraisal of the current situation. What's working to address the impacts? What recommendations do they have for equitable relief and recovery? We welcome all of you who have joined us for this discussion. We have some close to 1,000 participants from more than 100 countries, and we anticipate even more joining us via Facebook. And we are grateful that each and every one of you could be a part of this conversation. We have already received many pre-submitted questions from our audience members, but you will have an opportunity to submit questions to the speakers throughout this discussion. Use the Q&A feature on your computer to submit your questions and add your name, affiliation, and to whom you are directing your question. Before we turn to our opening speaker, let's watch this video. And we thank UN Women for setting the stage for us with that video. It now gives me great pleasure to introduce Michelle Nunn, who is the president and CEO of CARE USA. CARE, of course, is known around the world. It works in more than 100 countries and in some of the most challenging places to save lives, fight poverty, grow economic opportunity, and achieve social justice through the empowerment of women and girls. You will find CARE aiding in humanitarian crises, working in the conflict zones, and actively engaged on many a multilateral platform. Its president has been at the forefront of CARE's ensuring that women and girls are central in the response to COVID. Michelle has long been committed to public service, and I have been a great admirer of her efforts over many years. She has been a social entrepreneur, the CEO of a nonprofit, and even a candidate for the US Senate. Michelle, thank you so much for being with us. We look forward to hearing about CARE's experiences on the ground and your insights on the topic that we are working on today. Michelle.
Thanks so much, Melanne. And it is wonderful to be with you, somebody who is a role model for so many of us, who has, I think, laid the foundation upon which we stand to build gender equality and continuing to help us set the bar and the aspiration for where we must go. And this is such an important conversation, and you have assembled a perfect collective to really take a look at the impacts of COVID and also the opportunities for rebuilding with equality. And so I'm really delighted to have the chance to be with you all. And as you well articulated, but for those of you who don't know, CARE has been operating in 100 countries. We're actually marking our 75th anniversary this year, the delivery of the very first CARE package post-World War II. And as you said, we put women and girls at the center because we know that, and you all know this as well, that we can't overcome poverty, that we can't achieve the SDGs until everyone has equal rights and opportunities. And we've certainly seen that in the last year, I think so powerfully. And CARE has sort of tried to rise to this occasion. To meet the moment, we've been operating in 69 plus countries and reached over 30 million people in our COVID response. So we've had a real firsthand look at the impact of COVID-19 and how women are joining forces to move us through it and to move to recovery and to move us again to a more just future. So when we faced the crisis, it's hard to believe it's a year ago. It seems like much more than that in many ways. I think we all knew, all of us who focus on issues of equity and equality, that this was going to hit those who were already marginalized the hardest. And we've certainly seen that. We've seen that in the US and we've seen that around the world. And we've seen, as the video well showed, that always when there's a natural disaster, when there's a crisis, women and girls who were already unequal really face this disproportionate impact. And so one of the things that CARE did at the beginning of this crisis was to really look and say, how are we going to make sure that we are really engaging women and understanding their needs? And we have used a tool called rapid gender analysis. And in the last year, we've conducted over 51 rapid gender analysis in 51 different countries. And what we've seen is what I think we've seen around the world, I will also have to say. What we see in the New York Times about what women are facing here in the US is also what we're seeing in different measures and different degrees and with different levels of severity with women in the DRC or Sri Lanka. We're seeing disproportionate job loss. We're seeing hunger, and we're seeing issues of mental health and the dislocation of basic provisions of health services for women and girls. And so those are the three things that women and girls, we've actually interviewed over 6,000 women and girls around the world, have said are the things that we need to attend to. We've seen everywhere, again, that women are taking on a disproportionate burden of care. So imagine our concern as working mothers when our students are out of school and have been for over a year in many instances. Or when we see that every month that goes on in quarantine, an extra 5 million cases of gender-based violence are projected to happen. So we know that we've seen a disproportionate impact, but we also have seen that when women lead and that when we integrate them into the work of recovery, that we are more impactful in both the short and the long term. So at CARE, just as examples in terms of what's working, we've engaged women in helping to stop the spread, in actually stopping the disinformation. We have 10 million women that are a part of our savings groups, and they're talking to their communities about what they need to do to ensure everything from hand washing and putting in thousands of hand washing stations to women. One of my favorite stories of CARE's work in the last few months has been a woman named Akitu in West Africa, who saw what was happening in terms of the loss of livelihoods, organized a collective of women, and they're now producing 6,000 masks every single day, PPE, so helping support their communities, creating livelihoods, and really ensuring that they're on the front lines of making a difference. We are also prioritizing hunger. I think as we look at this issue of COVID-19, we have to look at the secondary pandemic dimensions of this. And we are seeing enormous challenges around hunger. We've created the opportunity for over 1 million families to have direct cash assistance and millions more to have the opportunity to have food. And so while we're turning inward, so many of our countries looking at the COVID epidemic itself, we also have to look at some of these other issues. We have to look at the mental health issues. We have to look at the gender-based violence issues. We have to apply what we've learned in other contexts. So for instance, we know from Ebola in West Africa that we had as many women die in childbirth and with maternal health complications as we did Ebola itself. So we have to address these things. And we now, as we turn to vaccinations, have to recognize that the frontline workers will be women. They'll be the ones that are putting shots in the arm, and they're the ones that we need to ensure that we're protecting, that we're supporting, and that we're engaging. And we've seen, I think it is indisputable that when women are leading, whether it's governments, whether it's task force for COVID, or whether it's simply informing and being at the table for decision making, that we have better results. And I know that you're going to hear that from this panel. So the final thing I would say that is not only do we have to obviously address the challenges of COVID, move through this to recovery, but we also have to build back equal. And so we need women to be at the leadership table to help us create a globally coordinated response, interdependent, standing in solidarity with one another, knowing that we have to resource and ensure that everyone has access to the vaccinations, because none of us can be safe until all of us are safe. And we also need to take a look at the structural and systemic issues that are before us. We need to, in the US, for instance, build upon the Biden administration's commitment to gender equality, their Gender Policy Council, which Melanne builds upon the work that you've done. And hopefully we can take that and continue to extend that. We need to lobby and advocate for resources. It's not enough to have councils. We have to have resources to support the quest for gender equality. One example that I would give, gender-based violence. You know, the Biden administration has, President Biden himself has a long history of addressing this issue. This should be an opportunity for us to pass the International Violence Against Women Act. This should be an opportunity for us to launch a global, a gender-based violence task force with equipping the authority, the resources to take on the challenge. And there's never been a more, I think, meaningful moment for us to tackle this issue at a significant level. So I know that we have to also take advantage, and you'll hear from Anita about the opportunity before us with generation equality. We have to work globally and we have to work nationally because we know that now more than ever, we must ensure that funding and influence goes to women-led crisis response, women-led organizations for the true, effective, long-lasting, and intergenerational impact that we're looking for. And I think this is an audience that knows it's not just the right thing to do, it's the best and most pragmatic way to ensure that we really make progress and that we achieve a more equitable and a secure and a just world for everyone. So Melanne, I'll pass it back to you, and I'm looking forward to hearing the wisdom and insights from the panelists.
Well, thank you so much, Michelle. I don't think we could have kicked off this discussion with a better context setting start than what you just gave us. And you mentioned so many things that I think are critically important and maybe we don't always focus on. One is the disinformation that is certainly prevalent in so many places, and the fact that it has to be counteracted, and a lot of that is happening on the ground. The whole cash assistance so that people can have the wherewithal to survive this. Mental health, and I like what you said about Ebola, because I think enough of us haven't learned from the Ebola lessons, and that's we often repeat the mistakes because we don't learn. And hopefully today our discussion will focus on what have we learned so far that we need to build on. And I certainly build back equal. That's really our intention. So thank you for all of those wonderful remarks. And we will now go forward based on that. And we will go forward with Anita Bhatia to kick this off. Anita is the Deputy Executive Director of UN Women. Since joining UN Women almost 2 years ago now, she has demonstrated that she is indefatigable and a vital force for advancing progress for women and girls. Prior to coming to UN Women, she was in many leadership and management positions at the World Bank and at the International Finance Corporation, and has worked really around the world, leading diverse teams to address a range of challenges. Anita was with us last year, and we're so happy she's back with us today. And I'm eager to hear what we know after a year and what we need to be doing to, as Michelle said, build back equal. UN Women has been actively engaged, Anita, on a gender-sensitive response to COVID, meeting the needs of so many around the globe. Where are we now in meeting those needs? I remember so well, a year ago, you worried about the survival of women's organizations who were doing everything and more with limited resources and greater challenges than ever. And they are critical in going forward. Where are we now in terms of what we're seeing for women's organizations? And just most importantly, what do we know that is working? Take it away.
Thank you so much, Melanne, and thank you so much for inviting me back. It's a real pleasure to be with a leader like you who really blazed the way for women's rights in your role when you were ambassador at large. And such a delight to be with everyone on this panel today to address this really important issue that you've raised on where are we today and what's working. And I really want us to focus on this piece on what's working, because we have been talking for a year about what's not working and what has gone so badly wrong for women and girls in this crisis. So Michelle laid out beautifully the issues that women are facing, in income, in health and security. And we talked about my worries and our institution's worries for women and girls last year. So I want to actually share some data, because we have actually spent the last year collecting data, because when we talked a year ago, the information was anecdotal. We were collecting information in, I wouldn't say an unscientific way, but we were collecting anecdotal data. Now we have data. We have launched with UNDP something called the Gender Global Policy Response Tracker. And we have the benefit of looking at what has happened over the last year to be able to say that all of the packages that governments have rolled out, the big economic fiscal stimulus packages, are not sufficiently targeting women and girls. They are simply not doing a good enough job just yet. What we know is only 25% of the countries that have rolled out stimulus packages actually have taken a holistic approach that covers violence against women, women's economic security, childcare, and social protection issues. And a shocking 20% of countries worldwide who have packages have done absolutely nothing that is focusing on gender. So we have a very long way to go. Now, in the midst of this gloom and doom, we also need to look at what is working and do a cut and paste and copy what's working in one context to another. So let me talk about what are some of the things that are working around 3 dimensions. First, in addressing violence against women and girls, we are seeing countries which are specifically targeting this issue and putting into their policy packages monies to go to essential service, to shelters as essential services. For example, we've seen this in Bosnia and Herzegovina. In Colombia, we have seen that the Ministry of Health has also put aside money specifically to address these issues. So, we have a couple of cases of countries where they have said, yes, we need to target. Number 2, when it comes to economic security, the fact is women lost jobs in huge numbers. And the big issue now is that women are not coming back to the labor force. You may have lost a job, but then things have reopened in many parts of the world. Why aren't women going back to jobs? It's because of childcare. right? So you need governments to really have comprehensive approaches to childcare, social protection. This means opening schools, providing, as the Biden-Harris administration has in the newest stimulus bill, money for reopening schools, making sure kids are going back to school to reduce the care burden, money to subsidize childcare providers, money for tax credits, unemployment insurance, paid sick leave. These are some of the things that governments are beginning to address. And then finally, I heard just yesterday, for example, from the Minister of Finance of Albania, that they are actually making an effort to target women-owned businesses and make sure that there is actually a flow of credit going to businesses and job creation that is led by women. So we are seeing examples in countries of very specific policy packages, but we're not seeing it at scale. So really, as we go forward, we need to be thinking about three things. One, targeting, because if you don't target programs to women, nothing's going to change. Number two, talking. Yes, we need to have more conversations. We need to see more op-eds like the one we saw from Vice President Harris, making sure we don't lose sight of this issue. And number three, we need to take action. We need the talking to be matched by walking. And so those are some of the reflections we have. I do want to say one word about women's organizations, because they have been decimated by the crisis, decimated. Let us not mince words. And unless we drive resources to keeping the voices of civil society alive, we are really in danger of creating a very different kind of world, because the voices of women have been vital in bringing awareness to these issues, but also lobbying governments to have the right kinds of public policy. So we will, through Generation Equality, ensure that there is a platform for women's rights organization to keep raising the right issues at the right times.
You know, Anita, you made so many really important points, and I just want to underscore this point about government's emergency and relief and recovery packages needing to have a gender lens as part of them. And really, if they don't, they're not going to be effective in the long run of addressing the critical issues. And I also think the divorce that we see between childcare and dealing with the economic dislocation that women are experiencing in huge numbers, that gap has got to close, and we really have to see childcare, as you well put, as an economic issue. It is completely tied to our economic recovery around the world. Mm-hmm. I want to ask you about something that I think has enormous potential, and that has to do with these economic costs, as well as the other huge disproportionate costs that COVID is bringing everywhere, but particularly to deal with the impact on women. And that's the gender bonds that mm-hmm. you have now been really recommending as a critical part of the equation in solving this building back equally, mm-hmm. and doing so in a better way, for sure. Tell us about gender bonds and the potential that they represent.
Thank you, Melanne. And I want to say at the outset that, you know, a lot, exactly as Michelle said, you need to drive resources to the agenda. You know, you cannot talk about achieving a status of building back equal if you don't have money for implementation of all of this. So there is really a need to bring the financing and the gender agendas together. And we have not been very successful at that. And the Beijing platform, as you well know, was not a costed platform. And we did not really talk enough in the last 25 years about how are we financing implementation of this agenda. And that's what we are now pushing and saying we have got to bring resources to the table. So gender bonds can work for a few countries. They will not work for all. They will work for those countries where they were going to access the market anyway, because they have access to the market, they have good credit ratings. But what we are in discussion with some governments who have that financial muscle and flexibility is to say, if you are going to be borrowing money anyway, because you're not getting enough from the international financial institutions, and you need that money for social spending and public health spending, well, then you have an opportunity to take that money and target it to those things, coming back to targeting, that really deliver impact for women and girls. So use that to finance projects, schooling, infrastructure, women's health centers, investments in reproductive health, investments in maternal well-being, investments in girls' education that we know are going to have a disproportionately positive impact on women and girls. So it's using the power of finance to drive results and to drive implementation. Again, I want to underscore that this will work only for a few countries. In fact, for many countries today, because of the massive amount of borrowing that they've had to do in the last year and the massive amount of spend to deal with both the public health crisis and the economic crisis, there's a real fear of debt and a looming debt crisis coming in many countries. So this will not be something that they can do there. But what we can do is make sure that whatever budgeting is taking place in these countries, A, is gender responsive, and all of the innovative financial instruments out there, green bonds, SDG bonds, thematic bonds, all of these need to have a gender lens in them, so that if you're spending as a government on low carbon initiatives, on a green recovery, that you bring gender into the green recovery as well. So in other words, really what we're saying is we're asking for gender to be everybody's business, not just the business of people who work on women's rights.
So important that you also mentioned these existing arrangements like the green funds, for example, where we have not seen, to the extent that there needs to be, a real gender focus. So that, and the need for resources, you can't do this without resources. And too often the instructions are, yes, we are going to support women and girls. We understand this is important, but then there are no resources applied to those intentions. So very good points, Anita, and we will, I'm sure, hear more from you as the Q&A portion of the program occurs. I want to turn now to Suzanne Ehlers, who is the president and CEO of the Malala Fund. And she leads a global team of experts and advocates who are working to ensure that all girls have access to 12 years of education, safe, quality, free education. Prior to coming to the Malala Fund, she's been a longtime advocate for women's rights, serving for some 10 years as the CEO of PAI International, an NGO working to improve women's access to quality health care, and particularly to reproductive health services. So Suzanne, we don't often talk enough about the impact that COVID is having on girls around the globe. One of the great progressive outcomes over the years has been trying to close that gap on educating girls. And to some extent, it's where enormous progress has been made. But what is COVID doing to that progress? I know that the Malala Fund has recently put out a report on those impacts, and it would be good for us to hear not only what is happening, but what are you doing, and others who care deeply about girls' education to turn around this impact that we're seeing now as a result of the pandemic. Good to have you, Susan.
Well, thank you. Thank you, Ambassador Verveer. And I was not with you last year at this time. I was only a few weeks into my role at Malala Fund before COVID. began to impact the work that we do around the world. So it's a real pleasure to be with you this round. And on behalf of our co-founders, Malala and Ziauddin Yousafzai, and our board and team, thank you for including the really important issue, and I would say pivotal issue, of girls' education in the conversation this morning. Last year we were, sort of pivoting like the rest of the world and sort of trying to make sense of the pandemic. And to your question, Ambassador, what was happening is that we expected that some of the trends we had seen, again, in the Ebola crisis, as mentioned by Michelle earlier in 2014, that those trends would play out again in this global pandemic of COVID. And so we launched really quick research, a global report that was going to test these suspicions and these hypotheses about the impact it would have on girls. And unfortunately, we found that we were right, that very quickly into the global pandemic, we were seeing world's schools shut, 90% of world schools shut. We were seeing 130 million girls having been out of school before COVID, and really rapidly increasing rates of girls expecting to not go back to school once the pandemic had subsided. We were seeing already sort of pressures as it related to domestic violence and intimate partner violence. We saw girls being put into caretaking roles and a real pressure to sort of make up for lost income at the household level. I mean, sort of right away, these trends were sort of crystallizing as it related to girls and their education. And so, based on the work of Malala Fund and so many agencies that are represented here this morning, we thought, all right, well, if that's sort of confirming our suspicions that some of these trends we saw in Ebola are going to play out again in COVID, let's actually go to the household level and let's test these findings. And so in the summer of 2020, we went to 7,000 households in India, Nigeria, Pakistan, and Ethiopia. And we asked students, we asked girls, we asked their households, is this true that this is really what's playing out in terms of your access to education? And again, we had those suspicions confirmed that girls were already predicting that they wouldn't go back to school. And this is in summer of 2020. We're now in February of 2021. 4% of girls said it in those household surveys, but you extrapolate that across low and middle income countries. Last summer, 13.5 million girls were saying, my chances of going back to school are not good. And we can only imagine that that number has increased exponentially since last summer. And the pressures that we knew would be put on girls were in fact put on girls. So what we did is we do what a lot of civil society partners do, just in terms of sort of what immediately began to work in terms of a response. We put resources in power to partners who were on the front lines of the response. We were creative. We sent a message of trust, of partnership, of stability. We said, we're going to move resources so that you can respond quickly to this pandemic. And if that means sort of using new strategies to respond to girls' needs in the middle of the pandemic, do it. And if it means being creative and innovative in terms of responding to the girl learning loss and the question around girls' re-enrollment once the pandemic is over, let's also do that. So that's, sort of a quick answer to your question, Ambassador, about what did we see? What were we able to confirm with our research and our data? And then what we heard directly from the voices of girls and their families when we asked them if these trends were playing out and how we could sort of stabilize a response so that those girls could get back into school when the time was right.
It's been heartbreaking, Suzanne, to read about what's happened to so many of those girls since they've left school. Trafficking numbers are up, child marriage is up. A lot of them are exposed to abuse, and that whole protective arena that they could function in school and develop their potential may be something that is not returned to them. And what we all have to work to make happen, of course, is that it is. I'm wondering, what is your recommendation about what can be done to make girls' education, particularly in those parts of the world that are still being challenged in this space, to make sure that it's central to relief and recovery responses?
That's a great question. And I've already heard, some of my fellow panelists sort of begin to speak to this. I heard gender conscious response. I heard structural and systemic responses, all of which are right. I also heard how do we bring out sort of like targeting women and girls, talking about our response, and then actually putting that into action. And that, of course, are all responses that we can get behind at Malala Fund. I think the first piece is that we've got to keep girls learning. Given that we don't know what the tail of this crisis sort of looks like like and when it will happen. In the meantime, we have got to do what we can to secure the continuation of girls learning where and how possible. And that means looking at the digital divide in sort of really gendered ways. Everybody is sort of e-learning and remote learning. And we know, because we heard from girls in households, they don't have the same access to devices. They don't have the same access to stable internet and electricity. They are the last in line when it comes to sort of quiet, reserved time for study after caring for sick relatives and after working outside the household to secure additional income. So whatever we can do in partnership with each other to make sure that we're keeping girls learning until we're on the other side of this is our first response. I think our second response is, as we begin to think about reopening, and in fact, my 5th grade daughter in DC is hoping to go back into her classroom in a couple of weeks' time. How do we do that safely? And how do we really keep a careful lens around gender and equity as we begin to think about reopening? I go back to those 4% of girls in our household surveys that last summer were telling us they weren't sure they were going to go back. So what number, how much has that increased? And what can we do to sort of secure re-enrollment figures for girls, so that we begin to make up for some of the learning loss that inevitably happened during the pandemic, and to really accelerate them past some of the challenges, Ambassador, that you laid out. And then I think the last and sort of probably the most challenging piece is really thinking about this finance question and thinking about how are we going to support ministers of education and finance in countries around the world to make sure that girls' education, but certainly girls' education is not lost when we are sort of so moved by more immediate and near-term responses as it relates to COVID and to the health crisis. We're going to have financial austerity. We're going to have sort of smaller public purses, and we can't let education fall on the chopping block. And the way that we do that is by collaboration. The way that we do that is by stopping to work in silos and to really see the interdependency of our efforts from a sector perspective and from the sort of through line that girls and women play in all efforts as it relates to to rebuilding, resilience, and recovery. So those are a couple of ideas, but I look forward to hearing more better ideas from fellow panelists and from the Q&A session.
Well, those are important ideas, and I think ones we can all hang on to, And when I think about education, I think about its centrality in development, and we really can't allow COVID to set back development, which is already what the data is showing us. So I think it's a really important area to focus on, obviously. So thank you, Suzanne. We're going to turn now to a dear friend of women in peace building around the world. She was with us a year ago. Mavic Cabrera-Balleza is the founder and CEO of the Global Network of Women Peace Builders, a coalition of over 100 women's organizations from over 40 countries, mostly countries experiencing humanitarian crises or conflict. She previously initiated the Philippine National Action Plan on Women, Peace, and Security, and has worked as an international consultant on 1325 implementation in many, many countries. Mavic, you've done this and so much more, but I really am eager to hear from you about what GNWP has been doing in this crisis. You gave us a strong hint of what was to come when we were last together. And I wonder if this year later, you can identify some strategies and interventions that you have found are beginning to make a difference in some of these truly hardest places where there are humanitarian crises, deep crises, and conflict happening all around the people who are struggling in those areas.
Thank you so much, Melanne, and the Georgetown Institute for Women, Peace, and Security team for bringing us together again in this critical discussion that highlight not only the impact on women and girls, but to all populations. And as we know, when women and girls are affected, everyone is affected. And when women and girls are able to participate in decision-making, everyone benefits. And points that are also highlighted by my fellow panelists. So thank you. I'll speak about our work in the past year that, as we all know, like many women's rights organizations, we had to pivot and pivot quickly, modify our implementation, revise our budgets, and many other adjustments that we had to do in our work, which takes place, by the way, at different levels: local, national, regional, and global. At the local level, we've worked with local women and youth peace builders in conflict-affected communities to distribute relief goods, face masks, hygiene, and sexual and reproductive health products. And as we all know, women's reproductive health needs are often not included in relief packs or not prioritized at all. We have also provided online counseling to women who were victims or at risk of gender-based violence. This is particularly important at a time when violence against women and girls, as already emphasized by you and my fellow panelists, is increasing at unprecedented levels. We've also produced local language radio programs and distributed local language posters on how to prevent the spread of the pandemic. There is a lot of misinformation and disinformation, and many people still believe that the pandemic is a hoax. And you know, it's not a surprise that their main sources of information are Facebook and TikTok. And that's why we need to counter that by distributing factual information in ways accessible to them. That's why I always emphasize the use of local languages. So in all this work, we've reached about 12,000 women and their families with the food and hygiene kits, and over 4.5 million with our public information campaigns. But of course, this is still a very modest number compared to the need. However, the strength of our response is in its swiftness and responsiveness to the special needs of women and girls. And the pandemic broke out in March 2020, and within less than a month, our local members were already conducting relief operations in internally displaced and refugee camps in communities that are caught between the conflict and the pandemic. So this effort is locally led and locally owned, and as such, they reduce vulnerability and build community resilience. Now, at the national level, we consistently advocate for the meaningful inclusion of women and youth in COVID-19 task forces to influence the response, and equally important, the efforts towards recovery. At the regional level, we've been discussing with civil society in Africa, in the Middle East and North Africa region, Central Asia, Eastern Europe, and South Caucasus, on how we can use the national action plans as instruments to respond and recover from this global health crisis. And finally, at the global level, we have established a COVID-19 and Women, Peace, and Security database that documents the specific impacts of the pandemic on women and on their peace-building efforts and response to the crisis. And this is a critical tool to promote gender-responsive and conflict-sensitive policy making. We have also successfully advocated for the establishment of the Compact on Women, Peace, and Security and Humanitarian Action, which emphasizes the nexus of these two important thematic areas. And the Compact is a coordinating mechanism that focuses on financing, which has been highlighted many times, monitoring and accountability for existing policy commitments. As we know, there's so many commitments and it's easy to make them, but it's another story to ensure that they are implemented.
You know, Mavic, it's important that you raise the whole ways that national action plans can be used in terms of the COVID response as well, because there is a relation there that shouldn't be one that's just marginalized to deal with some other issues. So I think that and your overall mentioning of 1325 and the frameworks that are in the compact that are being put together are very potentially very useful to think through and act through. But I heard a statistic just yesterday, frankly, that is astounding. According to the Secretary General of the UN, more than 130 countries have not received a single dose of the vaccine. And he noted that those affected by conflict and insecurity are going to be at particular risk of being left behind. And Michelle, of course, also mentioned the importance ultimately of getting the vaccine to everybody, because it's the only way that everybody, each and every one of us, will have this eradicated. But in addition to the challenge that that represents, I want to ask you the same question I asked Suzanne just now, is what recommendations would you leave with us in terms of creating a gender sensitive relief and recovery response going forward?
Thank you. That's a very important question. In fact, I really would like for us to come with concrete and practical recommendations from this conversation. And we realize that COVID-19 response, particularly from many governments, has been gender blind and peace blind. And gender inequalities, women and girls' needs are not taken into account, neither are the impacts of the pandemic on conflict and violence around the world. And as you mentioned, vaccines, while they are available to different segments of populations, there's still huge vaccine inequality. And in all of this, it's the people in conflict affected communities, and there's approximately 2 billion people who live in places impacted by fragility and conflict and violence who are affected the most. So, and again, on the issue of funding, evidence suggests that the COVID-19 and humanitarian response is neither localized nor women-led, and less than 1% of COVID funding is currently tracked, that has been tracked, is being channeled to local civil society. So the first recommendation is to ensure that women and young people are represented in decision-making in the response and recovery from the pandemic. And related to that is fund their participation, fund their continuing work. OECD data says that of the total annual fund for fragile countries, which is about $96 million dollars a year, only 0.02 go to women's rights organization. And the second recommendation is to ensure that there's funding for the implementation of peace agreements, and especially women's participation in their implementation. Many research have demonstrated that the pandemic disrupts or even completely stop peace processes. And these have very, very specific gendered impacts. And ceasefire agreements, for example, have been violated or have been easily violated or have expired and never renewed. And violence, as we've seen, has intensified in many countries and regions, Afghanistan, Libya, Nagorno-Karabakh, Yemen, and the Sahel, among others. The third recommendation is the emphasis on an intersectional approach. The pandemic, as we know, is not an isolated crisis, and it has emphasized our connectedness. But then the response doesn't take into account not just the impact on women and their capacity to contribute to the response, but also racial and ethnic inequalities, educational and income gaps, climate change, and other environmental crises. So intersectional approach to the response and recovery. And finally, I would like to emphasize on the need to address the digital divide and the gender gap within that divide. Governments and telecommunication companies should work together to ensure access that is safe and secure. And during this pandemic, it has become clear that access to digital technologies can be a lifesaver. And it has also has become our main venue for our work on peace building.
And we wouldn't be connected today if it weren't for that as well. So I'm really grateful to your mentioning it, because it looms large in terms of how we go forward. So going from the more general area of conflicts and crises globally to the specific. I'm just thrilled that we could have Raja Altali back with us, and so grateful that you can be here, Raja. She is a Syrian women's rights activist and the co-founder of the Center for Society and Civil Society, a Syrian NGO working to strengthen community engagement and advocacy for peace in Syria. She is one of 12 Syrian women appointed to the Women's Advisory Board by the UN Office of the Special Envoy. So we've been hearing about what's happening in a general way, most recently from Mavic. And I wonder, going to the specifics of what you're seeing in Syria, to the extent that there has been any kind of mitigation of the consequences, what has that been? How are you getting through in an area that all of us can relate to the seriousness of?
Yeah, thank you very much, Ambassador Melanne, for inviting me again this year for this important panel. And thank you all the panelists actually for the important intervention that was talked, especially like I can relate to the countries who are in conflict, who could be left behind in vaccination and the response of COVID, and also in the importance of gender equity regarding access to technology and also access to financial resources. And the most important for us is also being on the table in the peace process. So the last year, 2020, has been a very important year for Syrian women in order to continue their active role and participation in pushing the political process in Syria, trying actually. So there has been like many efforts from the Syrian women and Syrian women movement, Syrian civil society, to make sure that there is some advancement first on the ceasefire. And luckily the ceasefire kind of mostly has been like held during the last year, and which was a good sign. But at the same time, like the advancement on the political process hasn't played like a very important role. There has been, from the outbreak of the COVID-19 last year, three rounds of meeting of the Constitutional Committee, and not much progress has been done, some progress on the dialogue, but at the same time, the Syrian women and Syrian civil society has like stressed again and again to say that like in order to really respond to COVID-19, but also respond to the humanitarian situation that the Syrian people has inside Syria and also outside of Syria, the Syrians outside of Syria, we need to have a political solutions based on the Security Council Resolution 2254, which can guarantee also women and civil society participation in the peace process. It hasn't been very great year for Syrians in general. Like it's really like there hasn't been like a big hope in the political in advancing the political process. The financial and economic situation in Syria has been disasters. Like we can, especially people, the IDPs in the camps, even the refugee in outside, especially in the neighboring country, hasn't been in a very good shape and conditions, because like many of the countries and inside Syria, the COVID-19 has affected the financial situation. Syrian women specifically has, we got at Center for Civil Society and Democracy many reports regarding the increase of the gender-based violence and the violence against women during the last year, decrease in access to education for the Syrian girls and Syrian women, access to jobs actually is there. And most, what I wanted to discuss also, the situation of the detention centers in Syria hasn't been improved at all, even though this is one of the topics that Syrian women has played a very important role to highlight it. Like even with COVID-19, we don't have, like the Syrian government hasn't given any access for the Red Cross organization or like different organization for health access or and access. We didn't see really much of talks about like release of especially political detainees or like detainees who were like detained because of their participation in the Syrian revolution or the Syrian demonstration in the last 10 years. Many of the women and families of the detainees have been asking for more information on where is their beloved ones, and there hasn't been so much progress on that regard.
Well, thank you for mentioning, among all of the other severe challenges, the whole issue of the detainees, which often doesn't come up and clearly is a very serious issue. I wonder, Raja, given what's happening in Syria and what it represents, can you also give us some recommendations about what would make a difference if we could implement them that you know from the experience in Syria?
Yeah, thank you for the question. So I want to give like 3 recommendations. The first one on the political process. I know, like, I will repeat it again, but it's very important that political transition and political advancement in the based on 2254 in Syria is very needed. And it's very needed not only for a political solution, but also for the response for COVID-19. I know some of the panelists talked about like response on the global level and the national level, but in Syria, we are talking about at least 3 different areas where like you have different kind of response needed. So in order to do like better response and better recovery for the country, we need to have a political transition which is like really based on human rights, women rights, and also equity in access to the facility, like health facility, and also vaccinations. This will result in like equity in those, in both the recovery and the vaccination. The second one, like I want to talk about the resources, which is very, very important. Like we noticed that there has been a very big gap in the job in access to jobs for Syrians, and this is inside Syria, but also in the neighboring country. So finance empowerment and economic empowerment for Syrian women is very essential, but also for the Syrian civil society. So I want to echo Anita and Suzanne and Mavic on focusing a lot on the Syrian women organization and also Syrian organization who are led by women in resourcing them, and mainly like in humanitarian response, but also in economic empowerment. This is very essential. The last one, which I think Mavic talked about it, the gender, there's a big gender gap in access to technology. This is, we face it not only in political participation and economic participation, we face it in education, in health, access to health, we face it in even like training, like personal empowerment, etc. So the focus on making sure that women have more resources, and this is equipment, this is internet access, this is also like resources, training, like skills, in improving the women's skills in access to technology is essential. And I really hope that there would be more resources for Syrian women to access.
You know, I think it's always interesting when some of these recommendations get repeated or underscored with a little variation, because clearly there's a pathway there that we really need to embark on and understand the importance of these. And I think in addition to the resources piece and the technology piece that you mentioned, Raja, also it goes back to this intersectionality. You can't silo this. A political solution is also going to say a great deal about what happens to a COVID response that is so necessary. So thank you for all of those points. We're going to turn now to our audience questions, and I'm going to ask Allie to come in and put some of those to the attention of our panelists, please.
Sure. We have a first round of questions here focused on the spikes in gender-based violence. And a lot of people asking, could you expand on best practices that have emerged over the past year, as well as share any solutions for addressing this issue in a systemic way? And a second question here on accountability. So are there any best practices and recommendations around monitoring and evaluation within the pandemic context that could be highlighted? So if anyone would like to answer, please just raise your hand.
Obviously, very good questions dealing with the alarming increase in violence against women, what's being done, what can be done, what should be done, and then the whole issue of accountability. So important. What do we know in M&E? What should be in place? Suzanne, we'll start with you.
Well, I'll start with that second question. As a lifelong advocate, I love questions of accountability. And for me, it goes to I think sort of remarks made early in the panel around how under-resourced the women's movement has been historically and how the COVID crisis has sort of decimated so many women's organizations. And I would add to that advocacy organizations too are suffering. And for me, accountability sort of begins and ends with the voice and the resources that advocates need. And if that's in response to gender-based violence, if that's in response to girls' education and the learning crisis, if it's really pushing policymakers to get out of their silos and to sort of integrate and partner on their responses to getting us on the other side of this. For me, my first and best answer to accountability is to fund advocacy, to fund advocates, to give them flexible, sustained resources so they can build campaigns in partnership and collaboration across sector to hold policymakers to account for the pledges and commitments that they make.
Others want to weigh in on this?
Yeah,
Anita?
maybe I would. Yeah, I think what's really important for accountability is data. You need information because there is no way to benchmark performance if you don't actually have the data. And I actually think that, the whole world of coming back to, what we know from Beijing, what we discussed in Beijing and what we know today, right? The reason we are able to say that there hasn't been enough progress or there has been some good progress is because we have data. So for me, accountability is hugely linked to the issue of collecting, collating, and disseminating gender and sex disaggregated data. We simply don't have enough capacity in most national statistical offices globally to do this. And this is something UN Women really pushes through our Women Count program. But we need everybody who's in the business of sustainable development, including the large financing institutions, to get behind the sex and disaggregated data agenda. This was vital during the pandemic. The WHO has been collecting with us sex and gender disaggregated data to show what are the differing impacts of the pandemic from a public health perspective, but we need this across a range of issues affecting women, not just public health.
And it's often overlooked, but it is absolutely critical. And it goes back to resources. We not only need a commitment to the collection of data and its analysis, but we need the resources to ensure that happens. So that's right on. Mavic, I know you wanted to come in.
Yes, for supporting everything that was said by Anita and Suzanne and yourself. Accountability also needs, fundamental, or brings into the question the fundamental need for information. I'm thinking about South Sudan, for example. They had, after about 8 years, they finally came up with the revitalized peace agreement. And it was signed in 2018, and they were just starting to implement in February of last year, and then the pandemic broke out. But in addition to, people know that it's important, the peace agreement is important, the response to the pandemic is critical, but they don't know how. They don't have the basic information. All 8 years or so of the peace negotiation and finally a peace agreement go to states outside of Juba. People don't know what the peace agreement contains. People do not know who who is responsible for its implementation. So information and also creation of institutionalized, but at the same time, accessible mechanism to participate. And with all due respect to the advisory groups and the efforts to, to establish them, and I know many women, including Raja, one a great example of participating in them. A number of women peace builders are saying, we don't want to be just consulted and ask for advice, and then our voices are not integrated into the final decision. So consultation without meaningful influence in the decision making doesn't make much of a difference. So institutionalized mechanism for participation and accountability that are accessible. Thank you.
And Raja, thanks.
Yeah, so thanks, Mavic, also, and I echo everyone's response about accountability. I wanted to say that it's very important that not only collecting the data, but also like collecting what is there on data, because there are so much misinformation is there. And like one of the important job that civil society in Syria did, especially in the first 3 months of the COVID-19, of the epidemic, that like really raising awareness about importance of prevention and protections of the Syrian people. And this is, I'm giving an example of Syria, and I know that like in many other countries also Syria, like women and civil society played that role. So in addition to making sure that like we are following the progress that we are doing, but also identifying what are the goals that we wanted to achieve is very, very essential. Because like sometimes, so for example, when we are talking about like women participation, let's say in decision making, and I saw some questions regarding that, like it's very essential to identify first what are the influential decision making that we want women to be in. And also that we have direct participation and we have indirect participation, and always like having a range, like making sure that we are having some flexibility in making sure that women participating in different way is very essential. And this is when we want like also to support women civil society organization or women individual even. Like it's very important to be talking about flexibility in funding and also flexibility in resources. Like we know that like no one anticipated COVID-19 specifically. So it was very, very important to have some flexibility in funding during 2020 when we were able to support Syrian women with like even like simple equipment, etc. So when we had this kind of flexibility in funding, it was essential in like responding to the needs in timely manner, and this is essential.
I'm going to go back and see if we can take one more round before we come to an end. Allie?
Sure, 2 questions here. One is asking how climate change and equality can be factored into pandemic recovery. And another for Suzanne, following up on your comment encouraging local communities to use creative and innovative responses to this crisis to keep good girls in school. Could you share some specific examples of these responses that they proposed?
Okay, let's start with climate and then go to Suzanne, because we know that if we haven't learned anything from COVID yet, we are in big trouble when it comes to climate. So the synergies. Anita, you want to start?
Sure. So I think, look, there's a lot of focus now on really bringing attention to the climate change agenda, thankfully. And, you know, I think there is no way that governments can build back better without thinking about low carbon solutions and a green recovery, which is focused on renewable energy, which is focused on ensuring that, you know, we actually are able to live on the only planet that we have. So the Sustainable Development Agenda is really a people and a planet agenda. And to do that, all green recovery efforts will need to think about both the impact on women, which we know is severe, because, you know, when there are flash floods, Guess who's gathering the belongings? And guess who is having difficulty climbing up trees because of the clothing they may be wearing? And guess who's thinking about the food for their children in a displacement center after the tsunami hits? It's the woman. So we know that the impacts of climate change on women are profound, because women are the ones who are collecting water today. And if there is a drought because of climate change, they are the ones who have to walk many more miles. So we know that. So we want policymakers to integrate these concerns into green recovery, as you said earlier, green recovery funds, but also green recovery policies and any initiatives that are taken, whether at the federal, local, or city level, because a lot of green work is now being done even in cities, sustainable cities, resilient cities, green cities. So we want policymakers at all levels to be thinking about sustainability, both from a green and gender lens, and for businesses in the private sector to also, when they think about sustainability in their corporate strategies, to be thinking about sustainability as being broader than just green, but including green and gender.
And I think too often, Anita, we just see women as victims, and they are victimized and very vulnerable when it comes to the climate impacts, but we really don't see them as the problem solvers, as those change makers who have a critical role to play. So I think we've got to change our mindsets on that too.
Yes.
Anybody else want to weigh in on climate before I move to Suzanne?
I just want to give an example from Syria, if you allow me, Ambassador. So like it was the woman who brought the attention, like even like 2 to 3 years ago, about like the impact on the impact of the conflicts in Syria on the climate. Like, has been like a very shortage in services like electricity, water in many areas. And regarding the electricity and the heating system, people started using a lot of the like woods from the like trees, etc. So there has been like a really severe change in the climate in Syria regarding that, but not only of that, because of the bombing that was like caused especially by the Syrian government and also Russia on Syria, there has been like some even changing in the like health of many people. So this is where women brought this topic, and I know that like not so much was done about it, because even like for the war as a whole, nothing much was done about it. But this is like even on the local level, it's very important to address like the changes and the impact of conflict on the climate as well.
Yeah, that's a good example. Mavic.
Yeah, 2 quick examples. One from my country, the Philippines. We have an average of 21 typhoons each year, and often very, very strong typhoons. And the communities affected by these heavy typhoons are already the conflict affected communities. So it makes it easier for rebel groups or extremist groups to recruit young women and men because of the poverty exacerbated by the climate crisis. Another quick example is the locust infestation in East Africa. And we know this is brought about the cyclones in the region. And which are the countries affected? DRC, Uganda, especially northern part of the country, Kenya, countries that are already affected by the conflict. So my recommendation, especially being part of the board of the Compact on Women, Peace and Security and Humanitarian Action, that commits to really implementing existing policies and global commitments, let's bring these people who are experiencing the double whammy of climate crisis and conflict into the conversation. Ensure that the Generation Equality Forum really reach to those people, not just our small echo chamber in New York or in other global capitals. Thank you.
Well said. And Suzanne, you have the last word.
Well, thank you. And on the climate piece, look to Malala Fund at International Women's Day, launching a report where we're talking about the intersection of climate justice and girls' education. And not surprisingly, from the voice of girls, incredible integrated collaborative solutions for putting forward a green learning agenda that really gets at the heart of so much we've talked about today. So that's in a few weeks' time from us. Thank you for the question about kind of creative and innovative sort of responses and solutions. I guess I would lift 3 up really quickly. One is that we saw longtime partners like Kiki James in Nigeria really pivot almost immediately in the radio broadcast work they were doing in northern Nigeria to make sure that we could sort of stem some of the learning loss that girls were expected to experience. So those were investments that we were making, and we continued to make and stabilized and gave a long runway for the work that Kiki's doing with innovative broadcast materials in sort of a very different moment. Also longtime partner, the Arinda Network in Pakistan, and working with a mobile learning app and making sure that the government was sort of approving and supporting the curriculum that was being developed on this mobile learning app to reach literally millions of school children, including girls, in the middle of the COVID pandemic. So again, an investment Malala Fund had been making, but really beginning to sort of deepen and give that investment a much longer runway, given how critical e-learning and digital learning would be, and encourage the leaders of those organizations to be creative and responsive and innovative. And the last one is an example from Lebanon, also in the sort of mobile learning and e-learning, but creative and innovative in that we immediately said, do what you have to do with the current investment to respond to the crisis, to stabilize your operations, and to make sure that we're building as long a path forward for girls' continued learning and to stem learning loss to the degree that we can. We'll have more creative and innovative ideas about re-enrolling girls and getting girls back into school as that becomes a reality around the world. And I welcome you to watch Malala Fund's webpage and our social media platforms where we talk about what that looks like in hand with partners around the world.
Thank you so much. You know, we all have heard again, and we're constantly aware of the dire impacts that COVID is having, particularly on women and girls. But I think today we also know that there are many promising solutions and recommendations that pave the way forward. Clearly, they are still extremely challenging, and we confront that steep challenge. But I think we must remain resolute, and if we do so, there's no telling what we can do in building back better and equally. So I think we want to keep that in mind. I just want to also mention some work we're doing at the Georgetown Institute, where we want to continue to advance solutions like those that were raised here today. In partnership with the global law firm DLA Piper, we are engaged in research to document and address the alarming increase in intimate partner violence during this pandemic. And to that end, there will be a report coming out shortly that will contain innovative solutions and hopefully address that question we had earlier in this discussion about dealing with violence against women and girls, intimate partner violence. It will contain innovative solutions that include education and public awareness campaigns, non-traditional reporting methods, such as mobile applications, enhanced services delivery and accommodations, as well as access to justice initiatives. So please stay tuned for the release, and we will certainly get mention of it to everybody who has registered for this event today. And since the outbreak of the pandemic, we've also been working to capture recommendations and best practices for gender-sensitive responses and recovery. Please look at our website as well, because there's a range of key findings and related resources from others as well. And I think we all need, as we heard, to have the very best information so that we cannot replicate what hasn't happened that's made a difference, but begin to replicate and scale what is working so that it can have greater impacts. And with that, I just want to thank everybody for joining us today. I want to give special thanks, of course, to Michelle Nunn for taking the time to kick off this discussion, and then to our wonderful panelists to Anita and Raja, to Mavic, and to Suzanne. It's been rich, and I know there is a lot of work that each of you is doing every day. So we thank you, not just for today, but that work that you continue to do that makes such a difference. So to you and everyone who's joined us, we clearly have much work ahead. So ever onward and stay well. Thank you all.